Hello everyone. Welcome to this environmental research webinar. So before I introduce our today's speaker, I want to remind you and highlight our upcoming events. So two events on March 9 and March 16. March 9 we will have this energy equity and health impact assessment of Detroit Energy's integrated resource plan. And then the following week, there will be a panel discussion about this TSCA at 5 years. So please, make sure this. And then for this panel discussion, please register for this event to participate in this event. Okay. So I'm very happy to introduce today's speaker. My name is Kyun Park. I am the co-leader of the Integrated Health Science Core of the Michigan Life Stage Environmental Exposure and Disease Center. So today's speaker is Dr. Jamaji C Nwanaji-Enwerem. So Dr. Nwanaji-Enwerem is an MD, PhD, MPP candidate in his final year at Harvard Medical School and Harvard Kennedy School, and also a postdoctoral research fellow in environmental health sciences in the School of Public Health, UC Berkeley. He graduated Phi Beta Kappa valedictorian from Morehouse College with a BS in biology, and earned his PhD in the Harvard University Biological Sciences in Public Health program. He is an NIH National Research Service Award Principal Investigator and a Paul and Daisy Soros Fellow. His presentation, he present research examine the topics of environmental exposures, health biomarkers, and science, health, environmental public policy. So please join me in welcoming Dr. Nwanaji-Enwerem.
Hello, thank you for having me. Let me share my screen first and then I will get started. So can you see that? All right. All right, well, thank you for that intro and thank you for having me here this afternoon. I'm really honored to be able to share some of my perspectives with you. I'll start by highlighting what is on this first slide, though. So there are two images here. The first one on the left is from the Black Lives Matter movement and some of the events that they had here in the States this past summer. And the image on the right is actually from the End SARS movement, which was a movement that also occurred last summer, but in Lagos, Nigeria. So both of these were social movements. Both of them are fighting against law enforcement violence against unarmed persons, but they're literally oceans apart. Now, there's a lot on this next slide, and I don't want you to focus on all of it, but I show it to highlight that over the past 14 or so months, the pandemic has really shown us that events elsewhere can really impact us here at home. The overall message that I hope to surface is that even when it may not immediately look like it, so many of our experiences in some shape or in some form are shared. And the same applies to many of the problems that we have. And thankfully, that means that our solutions can also be shared. The emphasis, if it isn't apparent, is that so much of our experiences are shared. So whenever we shift and begin to look at topics like equity, it behooves us to maintain that shared perspective. So many of you have probably seen a slide like this or something similar. And for many, it helps to make a very important distinction. However, there are some that actually don't like this slide. And the main reason is because it implies here via height that there is a biological difference to ability. However, many of the issues that this image is often shown around are issues that are systemic and actually not due to biology, they're due to social constructs. I'll offer one additional issue here, and that's that this same image, as is now, implies that some of us don't actually need help. Just biologically, because of who we are, we're able to see everything. But whether it's standing on a box or sitting on the shoulders of your mother, as I'm doing here in this picture, or doing it figuratively, we've all been assisted in some way, shape, or form. And it's really important to have that mindset in all of our research. Whether it's, raising money from family and friends for a school event or something like that, we've all probably in some way, shape, or form been supported by a community. And through volunteer efforts or even our own research, it's also likely that many of us have pursued efforts that are in support of a community. And these two things are happening all at once, a sort of back and forth. And this is what I really mean by being in support with community. It's this perpetual standing of being in support of and being supported by. So over the remainder of the presentation, I plan to share 5 stories with you that demonstrate this whole idea of being in support with. And these are all stories from my own personal experiences. So the first focuses on ambient Black carbon exposures and eye health. So I was born in Nigeria. I was raised in North Carolina. However, throughout my life, we oftentimes went back home, and these visits were invaluable for me because they gave me insights into health disparities. One specific memorable moment that stands out in my mind is a moment that actually happened when I was already in medical school. And at the time, I had a family member who was dealing with a new diagnosis of glaucoma. And as many medical students know, once you start med school, oftentimes family and friends have a whole host of issues that they want to ask you. And this was one that I heard. And I remember spending hours and hours reading up on glaucoma, reading about its risk factors, things like age and race were mentioned. But a part of me felt like something was missing. At the time, I had also started doing research in environmental health, and I noticed that there really wasn't much mention of the environment. However, as I thought back and remembered vividly the areas where my family member lived, some areas that had unpaved roads, as you see on the left image here, environments that oftentimes were filled with exhaust from vehicles, some vehicles so old that they wouldn't pass inspections here in the States. Also smog and smoke from burning rubbish on the sides of the streets. When I thought about all of these things, I began to wonder if in fact the environment was at all affecting his ocular health or the health of his eye. Now, at the time, I was still a student. I was noticing that there wasn't much literature in that research area, but I surely didn't have my own funding to go back to Africa and run a study. So I decided that I was going to ask the question using a cohort of men that I was working with here in the States. And that's a study called the Normative Aging Study. And specifically, we looked to see if ambient Black carbon exposures in those men were associated with the intraocular or the pressure within their eyes. And that's something that's oftentimes shown to be a little bit high in people who suffer from glaucoma. So here I'm showing you a table of some of our findings, and you're going to see that there's various levels of model here, and that's just us starting off with looking at the direct association between black carbon and the pressure within the eye, and then in each of these models we add in variables like age, environmental variables, other health variables as well. But the big story here is that whenever we looked directly, we did not observe any direct association between black carbon exposures in the environment and the pressure within their eyes. However, we had done some other work, and in a previous independent study, we had applied something called an allelic risk score. So these were scores that were built from SNPs, and these were SNPs that were shown to be associated with various independent biological processes. So things like endothelial function, the processing of metals, as well as oxidative stress. So we wanted to say, okay, if we can't see anything directly, do we see anything whenever we apply these scores? And that's what I'm showing you now. And what we actually saw was, and focus specifically on panel C here, is that whenever we divided the men within the study into those who had a high oxidative stress allelic risk score and those who had a low score, we saw something, and specifically that there was a significant association in some of the men who had that high oxidative stress allelic risk score. However, whenever we looked at things like endothelial function or metals, there wasn't anything there. Now, this is one study. This is very early evidence, but it was inspired by a real world personal experience. And since this study was published, there's been a number of other studies that have supported these findings. And as I said, they're once again pretty early evidence, but we hope that as the literature in this area widens, that it can help usher in a number of reforms that help improve the environments of people who live in areas like my family member. Now, shifting on to a study of volatile organic compounds, I actually was able to work with a population living in a place called Ogali, which is actually in the Niger Delta region of Nigeria. Excuse me. Here it is on the map here on the far left. And Ogali is unique because it is a region that has unfortunately been the site of major oil spills. So since the 1960s, it's been thought that there have been over 4,000 oil spills in this region. And that's a huge issue because it's left the water in that area and the land in that area in a really bad state. And as you would assume, this likely has a number of effects on the health of the people who actually live there. Now, there have been some studies looking at the water in this area, some studies looking at the outdoor airspace in this area, but one specific area that we realized that research was missing was in the indoor home space. And seeing that a lot of people consider their homes to be a place where they're safe and aren't really exposed to things, understanding what that indoor airspace looked like was important. So we designed a study that would actually go in and, for the first time, to the best of our knowledge, actually characterize and measure the indoor levels of volatile organic compounds. So the study was published a few years ago. I want to say 2018, but I'm not sure. And thankfully, the results of it were shared with the local leaders in that area who are constantly working through legal battles and also working to try to find ways to provide relief to the people who live in their area. However, I'm going to share some of the findings with you, and some of these, and just to underscore them before I show them, this is from a handful of homes, so less than 30 homes that we looked at in that area. So we went in and we were able to detect approximately 19 volatile organic compounds. And the ones that I'm listing here are many of the ones who were at levels that were so much higher than the standards that we would accept here in the States. These were compounds like benzene, which we know can be involved with malignancy and also non-malignant health issues. So once again, highlighting that I was able to sort of go back, look at my own experiences, my own roots in some ways, and try to tackle some of the issues that are really facing the people here. This is definitely an area of work that an area or a space where I want to do more work in, because if in fact through more robust studies that we see that these levels are as high as that as we found here, these folks really need some interventions. So the third story that I'm going to tell you involves metals and aging. And while I was a grad student, Flint, Michigan was one of the major stories that we oftentimes heard in the news and the media. And at the time, I was doing research into what it meant to age from a biological standpoint. And a number of the markers that I was working with were novel. However, much wasn't really known with them in the metal space. So at the time, I was really working to understand the relationships of particles in the air and these biological aging measures. But again, not much was known from the metal standpoint. So spurred by those events and spurred by the lack of knowledge, we decided to once again explore this in the normative aging study. So more specifically, my research focused on environmental relationships of DNA methylation age. So these are markers of biological aging that can be calculated by measuring DNA methylation at specific sites. And these markers are special because they report on this biological aging phenomena that actually should show up before someone presents as being physically sick. And although we're still unsure if these markers are actually on the causal pathways of many of the disorders that we look at, or if they're simply a reflection of these pathways, they still represent a promising way to potentially monitor the status and health status, and also to monitor how effective various interventions that we have are. Sorry, I skipped ahead a second. So in this specific analysis, we used mixture methods, specifically a method called Bayesian kernel machine regression. And we used this method to evaluate the relationships of 5 metals, and that's arsenic, cadmium, mercury, manganese, and lead. So through BKMR, we were able to sort of select which metals were most important for the various aging metrics that I was looking at. I'm not sure if you can see my mouse, but these are the 3 major metrics, and we're looking at them both in their original form and in their form once you take into context someone's chronological age, and these are the 5 metals here. And through these things called PIPs, or these posterior inclusion probabilities, we're able to basically decide or figure out how important a particular metal is. So using a threshold of 0.6, any metal that shows up with a PIP higher than 0.6 is deemed important for that specific outcome. And looking at these results, what we see is that manganese was the sole metal that met this threshold of 0.6, and it was specifically important for the metric of phenoage. Now, whenever we looked in actual linear models, we saw that manganese, and that's down here, was actually significantly associated with phenoage, and the magnitude of the association that we saw was very shocking for us. So it was somewhere between or over, so a nanogram per mil increase in manganese was associated with approximately a 9 or 10 year increase in phenoage. That's much higher than anything that we've ever seen, but this again was a pilot study in about 50 men, and more results are necessary to confirm those actual findings. Lastly, we looked at the mixture as a whole, and so this is the mixture with all 5 of the metals within it, and what we saw was that once each metal in the mixture was at its 70th percentile, the entire mixture was significantly associated with having a higher phenoage. That's what's shown here on that image on the right. So now shifting to talk a little bit more about some advocacy work related to the pandemic and the indoor air space. So I was in policy school when the pandemic first started. And there's some irony because during our first week of school, so this was back in August of 2019, we underwent a zombie pandemic sim. So basically a simulation of the fact that the world or the country was being infected by some virus that was turning everyone into a zombie. And during this whole sim, we worked with other students to try to think through how to allocate things like food and medicines and things like that. And the irony is that in just a few months later, um, across the United States and everywhere, really, leaders were facing or being faced with thinking through some of those exact same issues. Um, However, while maintaining this mindset of thinking in this way and thinking about how a policy measure can impact those who are living in a specific area, and being a person who's doing research in environmental health, um, I really thought about what the stay-at-home orders really meant. And for me, they made perfect sense. Being at home made me feel safe and it prevented my rates of being infected. However, that might have not been the case for everyone. And I'm going to lay that out a bit more here. So, as I mentioned, my work primarily examines the impacts of particles in the air on health. And for me, being in my apartment or being in my home was a safe space. I felt as though the air here was safe. But for many people, people who are living in multi-family homes, people who are living in places with high mold or just rundown homes, that indoor air space may have not been as safe. It was a subpar home environment. So to be explicit, I believe absolutely that the stay-at-home orders were right. They were the right thing for everyone. But I also believe that the pandemic has provided an opportunity for us to reflect on how we think about the indoor airspace and the policy that shapes that space. So we wrote an article that was published last summer, and it helped us to really think through why there was such a disparity in the way that we handled the indoor airspace and the outdoor airspace. So traditionally, we think of indoor air as a you thing and a me thing, right? So the air outside, we're all walking outside, we share that space, but whenever it comes to the air inside your home or your apartment, I have my air and you have your air. But the pandemic helped us to really see why, this might not be the best framing. So I think that everyone now sees that hospitals are something that we all share. The more people that are sick, the less space that we have in hospitals. And that was the exact rationale for having people stay at home. If we could control the rates of infection, less people would have to go to the hospitals. And that would mean that the hospitals would be more open for those who needed them the most. However, if we think of someone who's really young, who maybe has asthma, or someone who's much older, who has some sort of cardiovascular ailment, having an unsafe indoor airspace actually matters quite a bit. That person may end up having an exacerbation of their asthma. They may end up having to go to the hospitals anyway, and to some extent, that's sort of defeated the purpose of having them to stay at home. So the indoor issue being an issue of your air versus my air really isn't the best framing, because as we now see that the indoor airspace actually has an effect on all of us. So right now, the Environmental Protection Agency does not regulate the indoor airspace, although there are guidelines for various substances within the indoor space. And state and local governments have actually stepped in to provide standards for spaces like schools and things like that. But what this results in is what we describe as patchwork legislation. So here I'm showing you slides A, B, and C, looking at radon, looking at forever chemicals, and looking at schools. And the filled-in states here represent states with some sort of indoor legislation pertaining to the school or the forever chemicals or radon here. And you could see from just these three pictures that for some things, there is pretty good coverage overall, but for some things, the coverage itself is actually lacking. So the main thought is maybe the pandemic has given us a framing and a sort of shift in mindset that allows us to think about possibly bringing some sort of federal legislation into this area. And there's no doubt that passing legislation would be hard. However, this framing in this moment may be the time for it. And it's important to highlight that this wouldn't be the first time that this would be looked at, that in 1994, the Occupational Safety and Health Administration proposed federal rules for ventilation and indoor air reporting, et cetera. But because of pushback from various industries and because of a lack of political will, that legislation actually did not happen. So now the final story that I'm going to share with you is a story of road safety. So I was watching the local news a few months back when I saw this story pop up, basically that the state of South Carolina was looking to propose stricter penalties for any person who was found to drive slowly in the left lane. So specifically, if you were moving slowly in the left lane of a multi-lane highway, you could receive a misdemeanor offense with a monetary fine and potential points against your license. Now, almost immediately from whenever I heard this, something made me take a step back. I thought from a road safety standpoint, this made sense, but something else seemed to be missing. And especially whenever it comes to this whole idea of law enforcement, there seemed to be something important that was left out. So over the past few months, many of us have seen statements from a lot of public health orgs and a lot of medical entities really describe the fact that police violence is a public health issue. This was one of the statements here. However, whenever a number of these statements came out, individual public health scholars really didn't know how they could do their part to help. Now, there have been a number of articles written in this area, and I've pulled some points from one of them. And in this article by Elang in 2017, they highlight that they urge public health scholars to introspectively reflect on racist practices in their own research, their own education efforts, etc. But they also urge the scholars to advocate against policies that may actually promote racism. And in the spirit of that last point, I knew that I really had to speak out and potentially say something about the risks that could come with that South Carolina legislation. So in doing my own homework and reading, it became obvious to me that South Carolina faced a number of the same issues that a number of us have really heard about. So we all know names like Ahmaud Arbery, but there are so many other Black names, Black persons' names, who we will never know. And such was the case for Walter Scott, who was a Black man that was actually murdered by the hands of law enforcement in South Carolina. So we did a bit of our own research as well, and we saw that some of the same disparities that we heard of before actually apply in South Carolina as well. So this is a graph that on the y-axis shows us the total percentage of police stops in South Carolina from 2005 to about 2016. The solid lines are the percentage of the stops by race, and the dashed lines show us the percentage makeup of each race, and that's based on census data. And what we see is that for Black people, that their percentage of stops is actually higher than their total share of the population. And one other thing that's scary is that you slowly see that line is actually rising. So I bring this up to basically say that any discussion about reforming law enforcement, almost anywhere, but especially given what I've shared with you about this South Carolina context, you have to have these talks or bring these things up with the discussions that are also centered on racial health equity. So in our forthcoming article, which I hope will be out in a week or so, we discuss a number of things, but one of the solutions that we bring up actually takes a lesson from the NIH. So given the past harms that have been done to people who have been in research studies, now for any study that's proposed and that wants to get grant funding from the NIH, that study must have a section within it that explicitly outlines potential harms to people who are in the study and how the researchers or the people who are running that study plan to lessen those various harms. So you can imagine a similar set of standards, even on a state level, being developed for any proposed public safety measure, such that any legislation moving onwards has a section that explicitly talks about any racial equity issues and any risks, and how the people who are putting forth the law plan to add in protections to help mitigate those risks. So over the last several minutes, I've shared with you a number of stories from my own experiences that outline this whole idea of being in support with. So this whole idea of both being supportive of and being supported by. And as I look at the screen now, I'm sure that most people here likely have examples from their own lives. And I urge you to hold those experiences near, because those experiences really help define what all of our lives and our work is about. It's really working towards making the earth a better place for all of us. So with that being said, I'd like to thank the many people who helped with much of this work. Some of them are here on this slide. And with that, I will take a step back and and just basically hear from each of you. So thank you so much for allowing me to share.
It's a great presentation. Thank you, Dr. Nwanaji-Enwerem. And so this is amazing. So you did all these 5 different, very, each topic looks so a lot we can discuss. But anyway, so I want to open any question from the audience.
And I'll stop so I can see.
Yeah, you can stop sharing. And then today so this meeting is just a meeting format, not webinar. So if you can unmute your the microphone and then video, and then you can ask, or you can also add your question to the chat box, and then I can pass that to Jamaji. So.
Hi, I guess I'll start. Thank you so much. I really enjoyed your talk. I thought that was one of the best explanations of DNA methylation being used as a biomarker for biological age. And given that, in the context of everything else you talked about today, I'm wondering if you have any advice for communicating, and you also had some genetic data, so communicating back to the study participants or to the greater community the results of omics studies, and in particular DNA methylation studies, not necessarily on the aging, but we can associate them with many things, and we don't yet know if they are resulting in positive, negative, or sort of no effects. So I'm wondering if you've ever thought about that.
Yeah, I mean, so that's something that's been on my mind a lot, especially whenever we think about how do we sort of share research and even various things about what the vaccines mean, how the vaccines supposedly got here so fast, things like that, with people who may be not as familiar with thinking about research, right? And I think the big thing here is that a number of these markers that we write about and look at are not markers that have gone through like the appropriate medical studies, right? So we can't per se say that, this marker means that in fact you will have this various health issue later on. But I think saying that the reason why we're looking at them is because we think that they could possibly do that is something that's still meaningful, right? So I think whenever we think of research as a whole, we oftentimes think we're going to go in, study this thing, learn this thing, and move on. Whereas we can tell the people that are helping us, the people who are within these studies, that, we don't know everything. We don't have everything figured out. And it's only by working with you that we can figure these things out. And the answers that we are going to come up with in the next 6 months or so, they're going to be written up and we're going to publish them. But it's a thing that moves very slowly, and we can, share these findings with you. But there's likely going to need to be another study for us to sort of move things to that space where we can actually say it's safe for you to go to your doctor's office and they can measure this thing, and then actually say, based on this measure, which we now have validated through a number of studies, through thousands of people, I can give you this health advice. So I think it's just sort of setting up that expectation that this is a slow thing, that we don't have it all figured out, that it's working with you and sort of this going back and forth, that we can get to that space where maybe we can provide those more, I guess, concrete answers.
Thank you. I really appreciate that perspective so much.
Thank you.
So we have a couple of questions from the chat box, and I will start from the bottom and then the next one. So Jamaji, you don't see that the mess, or are you? Can you see that mess? So chat box and
we looking at is this your project have come to be specifically in Nigeria? So some of the ones that I shared here, but I am still finishing med school, so haven't been able to actually go back and start any like direct work there. But one of the things that I think is meaningful, and for students or people who are in the same space as me, is just being able to listen to your family and friends and being able to like hear about the issues that really matter for them. And then taking in, even with the bit of knowledge that you have now, there's ways that you can think about things, maybe write about things and share them in spaces that can still be very meaningful for them. So like one of the things that I recently heard a lot about and that I've recently written about, I'm trying to find a place to actually submit this now, is that a number of my older family members and friends back home were really saying, the pandemic is a scary thing. I'm gonna look into taking ivermectin or hydroxychloroquine or this medicine. And there are things that you can that you don't actually necessarily have to have prescribed in those areas. You can sort of find someone who's has it in their pharmacy and you can buy it and you can sort of self-medicate. But that becomes a dangerous thing, especially when you don't have a doctor or someone who you're constantly speaking with. So being able to like write about that risk as something that I've personally observed and that I've seen affect people that I know is one of the most recent things that I've been able to sort of work on in that space.
And then the next question is about your next step in your academic journey.
Yeah, I'm going to residency. So I find out where I match in a few weeks. So I'll be doing residency in emergency medicine. And while I'm working on that, I hopefully will find some space to keep doing research as well. And then after that, find a space where I can do both things. So practice medicine, but also do some really impactful work as well, research work.
Yeah. So anyone else? So you can unmute or you can put your question to the chat box. So while you are thinking about the question, so this 5 different story, yeah. So this is very interesting, but when you talk about this environmental health disparity, and so mainly this environmental health disparity issue is related to kind of residential segregation. So where you live matter, and then that determine what, or to what extent that this the toxicant or contaminant level we can expose. So we have a chance to be exposed to those chemicals. So in your Nigeria story, so you show this VOC exposure from that oil spill area. So so it would be interesting if you can give us a little more details of how that area in terms of this residential kind of segregation depending on based on the socio-economic level or other factor, and then how that can impact this potential the environmental health disparity.
Yeah, for sure. I want to take a second and really reflect on one of the things that you said there, which is, where you live matters so much, right? It affects things from the way that you speak, the food that you eat, and also the things that you're exposed to from like the environmental health standpoint as well. So the place where this study actually was taking place is more of a rural environment, homes that actually have quite a bit of ventilation. So the indoor air space oftentimes is or can be somewhat reflective of the air outside. We did passive monitoring here. So we put the monitors basically in areas away from windows and things like that to really try to capture a sense of what was happening in the indoor airspace. And then around some of the homes, we also had a monitor outside. And whenever we compared the indoor monitor to the one outside, we actually saw that they weren't one in this, they weren't exactly the same thing. So we actually felt as though we were getting a reading of this indoor space. As far as what types of things that you could find inside, this really isn't a space where you see a lot of indoor stoves and things like that. So that's mainly in the outside space. But things like furniture could help shape what's in the indoor space. One of the things that we think about now are like sprays, like perfumes, things like that. Sanitary sprays, so like Lysol sprays, things like that affect the space inside as well. So it is unique from a number of standpoints. And one of the things that would be really neat in a future study is trying to figure out, okay, of the compounds or the VOCs that we measured, where are they actually coming from in that indoor space? And being able to sort of pinpoint things that way, I think can help us also figure out where we can intervene best.
Thank you. And one question from Amy. So you see the chat box?
Mm-hmm. Thinking about multiple ways to do your research that's responsive to community priorities and concerns. Yeah, definitely. Thank you for that, Amy. Yeah, I mean, I think with these things, like there is no right answer. That I think that, I could see one thing and say, oh, I think this is a very important factor for the people who live in this area. And then I go and meet them and they're like, no, that's not the thing that matters most. It's this other thing. So I think being open with, priorities for me or for us as people doing the research, as well as the priorities from the people who make up the study and trying to find the best alignment from those areas is something that really matters a lot. And it just sort of falls on us being able to ask and provide like an open space for people to share those things.
I have a quick question. Thank you again for this talk. It was absolutely phenomenal. I was recently having a talk with some of my friends and peers here at the School of Public Health. I'm a second-year master's student studying occupational and environmental epidemiology. And it seems like you do a very good job at centering somehow your experience in the midst of your research, or using your experience to kind of decide where and what things you want to look at in your research. Can you talk more about the process that you go about doing that? I know for a lot of us who are looking to go into academic as careers, sometimes it's hard finding institutions and spaces who are willing to hear those stories. And sometimes you can get caught up doing research that maybe you're not necessarily interested in, or maybe you're not personally affected by, but you seem to do a really good job at somehow relating your experience to your research. So can you talk a little bit about how and what way you do that?
For sure, yeah. So I think whenever you sort of go back and reflect on things, it's like, oh, wow, this sort of fits here and here and here. But as you're walking through those steps, it's not necessarily that up front. So for instance, like I talk a little bit about being inspired by in the story about metals and lead in Michigan and things like that. I was doing this research on aging separate from that. And it was only later on that I was like, oh, actually, we can sort of expand this a little bit and look at it from this angle as well. So there was already sort of a framework for the work. And then I was able to add this additional element onto that study. Same thing with the volatile organics study. I was actually in a lab with another student who was helping to lead that study. So being, again, in that space of people who may have similar ideas or similar aspirations really helps sort of bring that about. And then I think as you sort of go through these phases of learning basic research skills and building up your own acumen, then you can sort of take the lead more, I think, on the topics that you look at. So with the road law, that was a newer thing and that happened a few months back. And that was me thinking, okay, I've learned I've been in school for so long. I've learned all these things. How can I actively try to like apply those things to people that I think I live with and that I think this would matter for? So I would say don't get frustrated on the front end of things, that the learning in itself will help out no matter what. And then once you sort of build yourself up, that there is room for you to then sort of pivot and try to make things fit your story or your experiences more.
Thank you.
No problem.
So we have time for 1 or 2 questions. Okay, so then maybe I can ask one. Also, Marie, so if you have questions, so go ahead. So
I'm trying to choose between the many coming into my mind, but thank you for a wonderful talk, and I'm resonating with many things you're discussing, and the normative aging study cohort, which Sung Kyun and I have worked on, is it's an all-white male cohort of veterans based in the Massachusetts area, and I think to Quinton's point, the fact that you can learn things about Black carbon and intraocular pressure from this cohort that is very different from the relatives and friends who you were concerned about in Nigeria with respect to glaucoma and other conditions. I think it sort of illustrates the point, and I just think it is amazing to be able to connect those common learnings from one field or one cohort or one part of the world to another. So it's not so much a question as just an observation that, I also really like the way you connected your own personal experience and that you're bringing your public health thinking beyond, academic medicine and environmental health. So thank you for that.
Thank you. Yeah. I mean, I think that whenever I thought about so many of those issues, it's like, okay, I don't have the funding or I don't have the time to actually go back and study it in this specific area. But the lessons that I learned in the areas that I can work in matter still. And if I can do that work now and that can help sort of shape how everyone thinks about these issues, if I ever do have the funding and the time to actually go and study this specific sector of people that I actually inspired this work, then those findings and those impacts will be more received by the field overall because we've already started thinking about these types of issues.
okay, so 12:50. So great time to end this fantastic presentation and discussion. So thank you, Dr. Nwanaji-Enwerem, for your great presentation, and also thank you for all the audience to attend this seminar. Thank you.
Thank you so much. Take care.